So welcome back, everyone. We are approaching the end of what has been a very busy and exciting day one. I hope you have enjoyed it. I want to start by really acknowledging the hard work of the entire PSC Partners team, and I've watched that again throughout the day today as they will put this event together and then run it beautifully with the support staff. The decision to make this a virtual conference was really a hard one, but after making that decision, I was just so impressed with how quickly the team pivoted in short order, put together what has been a fantastic conference. We fully understand nothing beats actually being able to gather together in person, but the PSC Partners team made this a close second. We are very glad you're all here. I also want to say it was an honor to be asked to co-host this event. I have made the care of patients with PSC a primary focus of my clinical practice since I completed my fellowship 27 years ago. I never imagined that I'd be the gray-haired guy talking about the old days, but here I am. As many of you have personally experienced, the PSC landscape was a bleak one for many years. There was no progress being made seemingly on understanding the pathogenesis, and we had next to nothing to offer for treatment, certainly nothing that was proven to be a benefit. Things are now absolutely changing, and that landscape is becoming a more hopeful one. The glacial progress of the past is being replaced now by small but clear advances on a number of fronts, all a sign of a gathering momentum that will allow us to chip away at the mysteries this disease has always held so tightly. PSC Partners, an apt name if there ever was one, is an essential partner in that process. We started today with Dr. Feigenbaum's inspirational talk, highlighting how he and his team developed a new model designed to accelerate research and treatment for rare diseases. This is achieved by facilitating collaboration among the global research community, mobilizing necessary resources, and strategically investing in high-impact research. Most importantly, patients and their loved ones are an important and valued stakeholder in the process. We followed that with the official launch of the International Collaborative Research Network, modeled on the Castleman Disease Collaborative Network. And this is a remarkable PSC Partners initiative that has many of the same goals put forth by Dr. Feigenbaum, with the primary goal of accelerating PSC research. We heard about the draft PSC Partners research agenda as presented by Ruth Ann Pye. We have productive small group think tanks specifically designed to allow everyone's voice to be heard as we work together to guide the ICRN research agenda over the next 5 years. An absolutely essential part of success of the ICRN is the collaboration and inclusion woven into the fabric of this initiative. This cannot be the agenda of any one person or small group of people. It needs to include the thoughts of a wide range of researchers, clinicians, patients, and loved ones. The potential of the ICRN is great, and the importance of its launch cannot be understated. It is important to note that PSC Partners will not be putting all of its eggs in the ICRN basket, as exciting as it is. The research grant program will continue. Talented researchers with exciting ideas should always be supported when circumstances allow. I want to end my part by reminding everyone that after this session, we will have the final session of the day. We will be hearing 4 exceptional oral presentations from investigators who have been awarded the PSC Partners Outstanding Abstract Award. I hope you will all stick around for that. I'll hand it off now to Dr. Korzenik.
Thanks, Dan. Delighted to be joining as well, and delighted as well to share some of my gray hair with everybody. But thank you for that very much. And thanks everyone for really what's been so far a great day. It's a challenge sometimes to be on Zoom for such extended periods of time. And we realize that, and we've tried to make a balance of breaks and changes in format and other things. I think that we're tremendously excited to sort of launch this type of collaboration and understand how to make it work. It's new for all of us in a certain sense, and how do we tap into this? And as I said to my group, I think that there's a couple things to keep in mind in these discussions. One is that it's often the person in the room who knows the least that asks the best questions. They're not biased or weighed down by conventional thinking, and they can ask sometimes the most obvious questions that aren't appropriately understood. The second thing to keep in mind is it's a quotation that's often ascribed to Mark Twain or Will Rogers, but probably neither of them said it. It's that it's not what we don't know that hurts us. It's what we know for sure that just ain't so. So all of those things that we think we know, we need to sort of question. Why is it that we don't have a cure or a deeper understanding of PSC? Is it that some of these assumptions we have are not accurate or not completely correct? Are these really autoimmune diseases? How important is genetics? While it's a chronic inflammatory process, why is it that none of the anti-inflammatory medications that work relatively well in ulcerative colitis and Crohn's have not shown to be a benefit in PSC? And is PSC one disease or many? Can we reverse fibrosis? Things that we have assumed we can't, we're now understanding that we can do. And so we really want to understand how we do this better and get everyone involved. How can we improve the PSC clinical trials enrollment? What were the mistakes of the Crohn's and colitis community? How do we enhance involvement of people with PSC to guide the agenda? And that's really what we've been talking about. And as Dan mentioned, research a long time ago used to be more of a solitary endeavor. Now it's really bringing groups together. And that's where this conference and PSC Partners has been so important. We're excited about this next session and excited about tomorrow to give some sense of progress in research. You'll hear a number of really interesting posters. We're excited about our own group's poster in terms of diet in PSC, and also give a sense of tomorrow some of the progress that's being made in terms of research in terms of getting at what's the fundamental pathophysiology or guidance of what happens in PSC, as well as some of the advances in terms of understanding the connection with IBD and understanding what's happening otherwise. We'll also be introducing you more to some of the other research initiatives that's happening with PSC Partners that are tremendously exciting, and really giving a broad overview of where we are and where we hope to go and get everyone's input. So very exciting times, very exciting progress today and tomorrow. And I'll turn this over to Ricky now to introduce the next session.
Okay. Thank you, Dan and Josh, for everything you've done in the past year and also today. I just think it was a great day. And thank you to all the excellent presenters. We're just so happy as patients and caregivers to see the medical community being open, ready to sort of open up that mold that's existed and really expand what's going on. So I hope that everyone enjoyed our first day and that you're leaving us today with exciting thoughts about the future of PSC research, which is a priority for everyone. And as Dan and Josh said, we started phenomenally the day with Dr. Feigenbaum's inspiring keynote speech, encouraging us all to turn hope into action for the PSC community. I continue to be in awe of what he has created. And his collaborative network approach is a dynamic model that we are following with the launch of our ICRNetwork, as you heard over and over. Also, as Dr. Feigenbaum mentioned, we are incredibly lucky at PSC Partners that Dr. Ruth Ann Pye joined our team over a year ago as Director of Research Strategy. As you can see, she is a powerhouse who leads our research initiatives with her amazing knowledge and passion. Dr. Pye did a wonderful job today of explaining the draft of our comprehensive research agenda to make it understandable for our patient community. And during the following panel discussion, Drs. Bolish, Schramm, and Trauner offered their individual opinions on future directions for this agenda. After the conference, we will summarize their expert advice as well as all the unanswered questions in the Q&A as we continue to collaborate with the research community. We launched our ICRNetwork today with our first multi-stakeholder crowdsourcing during the think tank session to get valuable input from patients, caregivers, clinicians, researchers, and industry reps on PSC Partners' draft research agenda. I hope that all the think tank breakout rooms brought up ideas from multi-stakeholders on personal priorities for the most important research questions to be studied. Again, we will organize and analyze all these notes taken in each of the breakout sessions, and through ongoing multi-stakeholder discussions together, we will develop a PSC 5-year strategic research plan to help guide future research and drug development. I want to thank everyone for your participation and your shared opinions. and encourage fellow PSC patients as well as caregivers to continue to speak up and to realize the importance of your voice in all of these initiatives within the ICR network. During a session for clinicians and researchers that was way too short today, medical community discussed how to identify and mitigate health inequalities in PSC, led by Dr. Kidis Imam. And under Dr. Imam's guidance, PSC Partners plans to continue working with clinicians and researchers to find ways to improve healthcare for underrepresented and disadvantaged patients with PSC, and to be sure that they are included in future clinical trials. I hope that patients and caregivers enjoyed the Tai Chi, mindfulness, and restorative stretching sessions, as well as the Meet the Professor opportunities. So thank you also to today's attendings for participating in all of our sessions. And now here are a few highlights of the upcoming events this afternoon and tomorrow that you won't want to miss. Please stay online now for the outstanding poster abstracts live presentations, which will start in a few minutes. From 2 to 3 p.m. Mountain Time today, there's a casual meetup for our Canadian attendees. All Canadians, please join and learn about what is happening with our Canadian affiliate, wonderfully led by Mary Vias. Exhibit booths, which are industry sponsors and also PSC Partners booths, such as our registry and the Canadian booth, will be open from 2 to 3 p.m. today, tomorrow from 7 to 8 a.m. before we start the sessions, and also 2 to 3 tomorrow after we finish the sessions. So please come chat with industry partners and also our registry team. We have a jam-packed agenda again tomorrow. Start with a great panel discussion with 4 PSC patients sharing what it means to them to live with PSC. The next session with 3 presentations and a Q&A session will cover the most exciting international updates from the past year of PSC research. We will continue caring for you and Meet the Professor sessions for patients and caregivers, as well as a session for medical professionals on PSC Partners Grants Program. Next will be an international discussion on the power of natural history to support drug development for PSC, followed by a presentation on the progress of PSC Partners' planned WIND initiative, which stands for Worldwide Integration of Natural History Databases. We need all of you to join the WIND think tank to share your questions and also your vital feedback to guide us in our next steps. Last but not at all least, we end the day with a presentation on PSC Partners' Patient-Reported Outcomes Measure, or PROM project. For patients and caregivers, we will finish up with a time to celebrate session. By the end of day tomorrow, we hope that you will have a clear idea of the major steps that we as a patient organization are taking to help accelerate PSC research and drug development. With our patient voice combined with continued input from the medical community, we will make strides with this combination of our PSC strategic research agenda, WIND natural history study, and the creation of a PSC-specific patient-reported outcome measure. You all play a central role in our progress. So now be sure to stay on as I introduce Dr. Heather Francis, who will moderate the live presentations of the outstanding poster abstracts. This is the first time that PSC Partners has included a poster session in our annual conference, and we are really excited about it. Today, we will feature 4 expert researchers who are recipients of the Oral Abstract Award. Before we begin this session, I would like to highlight the recipients of the inaugural PSC Partners Patient Partner Award. This year, the recipients are Dr. Gila Sasson with presenter Maya Paul and Diana Nakib. These researchers, along with their collaborators in the Korzenik lab at Brigham and Women's and the McParland lab at the University of Toronto, have collaborated closely with PSC Partners to ensure the PSC patient voice was captured in the design and implementation of these research studies. Congratulations to both teams. We look forward to continuing our work together and to partnering with more researchers over the coming year. Many congratulations as well to the recipients of the Young Investigator Award. We see a very bright future ahead with you as emerging leaders, and we hope that you will continue researching our rare disease. And now I'd like to introduce our moderator, Dr. Heather Francis, who is a member of PSC Partners Scientific Medical Advisory Committee. She's a professor of medicine and the scientific director of the Indiana Center for Liver Research at the Indiana University School of Medicine. The goal of her laboratory is to investigate the role of cholangiocytes and mast cells during cholestatic liver injury, focusing on PSC, cholangiocarcinoma, and non-alcoholic fatty liver disease. So now I would like to turn it over to Dr. Francis. Thank you.